Late Dr. Grace Arach, a newly qualified pediatrician, is now one of the statistics of health workers that have succumbed to COVID-19. Dr. Arach is one among the many health workers who risked their lives and paid the ultimate price. Uganda Medical Association now wants health workers to be prioritized according to the risk they face. Dr. Daniel Tumwine is a member of the association.
Just in this month alone, we have lost 16 doctors, but 14 of those have actually died because of COVID. The majority of them have actually been our senior doctors who have actually been practicing. There are people who, I think there's one health center where almost all the doctors are down. We're really saying let healthcare be invested in.
In the first COVID-19 wave, the Ministry of Health argued that most health workers were getting infected from the community and not as a result of their work. However, Dr. Tumwine says there is a general shortage of personal protective equipment.
Both the private sector and the public sector and the government have been trying to train health workers on infection control, and this has been good, but it's useless knowing what to do when actually you don't have any protection. For example, we always say that if you're going to do a test or if you're going to have someone in ICU, the air must be at negative pressure, almost as a mini vacuum. But how many places have that in place? Okay, in Uganda, most of our ICUs are all in Kampala. What we have mostly in the regional centers are the high dependency units.
Currently, health workers providing COVID-19 care in government facilities take home a risk allowance of only 5,000 shillings. This is coupled with longer working hours. Dr. Tumwine says for him it is protection first and money later.
And many people equate money to welfare, but actually there is so much more. Last year, for example, we lost one of our doctors due to infection that was caught in hospital. So protection is very key, the welfare is very key. We have petitioned government about this. We have petitioned almost everyone about the welfare of doctors. And there has been some improvement, but the movement in that direction is extremely slow.
In a country with a doctor-to-patient ratio of about 1 to 25,000, the loss of a single doctor leaves behind a big gap and has far-reaching ripple effects. Walter Mwesije, NTV.